afternoon and welcome to Let's Chat with Dr. Celeste MD. I'm your host. Certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions for both their acute and chronic medical needs. We do this through telemedicine, concierge medicine, primary care, COVID testing, COVID vaccines, as well as through my Amazon best-selling book Vitality. Good afternoon, ladies and gentlemen, and welcome to Let's Chat. I'm sorry that today's episode is a few hours behind. I actually was pulled away. I'm coming to you live from Dayton, Ohio, was pulled away. We had a speaking engagement today. And at the time that I thought I was going to be able to come and talk to you guys really quick, they needed me to do something before the speaking engagement. So I apologize. We just got done with the program and just wanted to kind of come on. And I'm outside. It's hot. It's not the best location. But I wanted to come on and just share a couple of points. And I'm going to come back to you guys live probably Tuesday and give something a little bit more substantial. But with the increase in cases, I have been out of town the last week and a half or so, but have been able to get caught up on the number of cases of COVID-19 that are going through or increasing in the state of Alabama. And so what I thought that I'd do today is just give you 4 simple tips to self-care July 25th, 2021, especially if you're a resident of the state of Alabama. I am aware that there are no mandates at this point about mask wearing at all. There are different entities that are, will go back and forth and deciding on that. What I wanted to share with you guys today is what I've been sharing with my patients, and that is that, think back, guys, it's July 25th of 2021. A year ago, we were using 3 things in particular to help decrease the risk of COVID cases and its spreading in our communities. And what I'd like to do is challenge everyone to pick those back up. The numbers are surging. I think that everyone is well aware of that. Over 80% of the cases of COVID-19 in the state of Alabama at this point have been linked to the COVID-19 Delta variant, nearly 80%. We know that our state had low vaccination rates. I know that there are a number of people that in the last couple of weeks have made the decision to go ahead and get vaccinated, and that's great. But in lieu of all this, even if you are vaccinated, I am encouraging my patients, whether vaccinated or not, to mask when you leave your home. Definitely mask when you go inside. That's part of the reason why I'm outside talking to you now, and my family is inside. We just got done with a program, and so we're trying to get the kids something to eat here. But I wanted to come on and just share with you guys a little bit. And I couldn't do it inside because I'm not going to take my mask off and have an extended conversations like the one I'm having with you now because of the risk of spread. Because we know that the numbers of cases are increasing and we know that the numbers are high, it's increased transmission rate, right? That's a reason to go ahead and mask, whether vaccinated or not, to protect yourself, protect your family, protect your home. We know that washing our hands makes a tremendous difference in terms of helping to decrease the risk of spread of COVID-19 and other viruses. We may have gotten a little laxed with that, understandably, in the last 6 months. And with COVID fatigue and setting, a lot of healthcare professionals are experiencing COVID fatigue because we've been going at this point for a year and about 4 months, I think. A year, 5 months, really. In about 5 months. So COVID fatigue is set in. So these are things that we may have forgotten how useful they were in helping to decrease the risk of spread. So the first is the masking, and we'll come back to that. The second is going to be making sure that we're washing our hands. The third part of that is going ahead and carving out for yourself that social distancing. There doesn't have to be a mandate for you personally as a person to decide, hey, you know what? I'm going to try and keep myself and, people in my family a little better protected. So I'm going to make sure when I go out that I keep a little distance from the people that are ahead of me for that reason. Doing that causes no harm to anyone. The fourth tip that we didn't have last year, but we do have in our arsenal now, lastly but not leastly, is vaccination. I know that there have been some breakthrough cases that people have heard about in the news, and there's a lot of misinformation that goes on with that. So social media is helpful in a lot of ways, but it's hurtful in some ways, in the sense that the accurate information that you have and what we need patients to do and what we need to do as a community to help us all stay safer is getting misconstrued in a lot of ways from different entities. So regardless of that, the one thing that we do know that no one can take from us is the experience we've had over the last year. If you look back in the news, you can very, pointedly go back. January 21st was the first case that was in Washington State here in the United States. By March, we were declaring a national emergency. And then by July, states were trying to reopen, but having to adjust their reopening plans because of the increase in surge in cases. And then by October, after Labor Day and a lot of the holidays and people gathering, we saw another spike and increase in cases. In the history of what's gone on in the last year, everyone can go back and see that two things surrounded the decrease in the numbers, and that was using the mask as well as vaccinations. Those are things that we have in our arsenal. I encourage you, if you're vaccinated, great. Protect yourself, protect your family. You're vaccinated. And what that means, and I know that you're saying, oh, Dr. Celeste, you're still telling people to get vaccinated, even though there's some people that are vaccinated that have COVID. I'm going to tell you it's a huge difference, tremendous difference in someone that gets COVID-19 that is vaccinated versus someone that is unvaccinated. What is definitely being studied and looked at, and if you look at the numbers, the amount or number of people that experience complications as a result of COVID from vaccinated versus unvaccinated, they're typically much more severe in someone that is unvaccinated. They're much more likely to be intubated. They're much more likely to possibly succumb to death. The cases of the infection are typically much more severe. So there is a very strong benefit in being vaccinated versus non-vaccinated. So please do not let that halt or prevent you from getting a vaccine, especially knowing that that's something that can help protect your family. If you're out there and you say, hey, I've gotten vaccinated, everyone in my house is, but there are certain individuals that will not become vaccinated. You as an individual have to do what's best for you and your health and to protect yourself and your family. I encourage you to take those necessary steps to do so. Sometimes that will mean that you cannot be around other individuals if you're able to create that distance, if you're able to safely and in a way create that distance. So that's all I had to share with you. I apologize for the lighting. I know it's not the best, as well as me sitting in a place that I'm sitting now, but just wanted to come on to remind you guys of that as we're seeing the numbers soar, and to just remind you of the things that you already know. You don't need us to tell you to put on a mask. I think that everyone is extremely intelligent, has followed this very closely, and knows, hey, if the masking helped to protect me before, it's something that will work again. Very simple measure, huge effects if you utilize it. Huge effects if you utilize a mask. Much even more huge, of course, if you're vaccinated. So anyone that is looking for vaccinations, our office is at 401 Tuscaloosa Avenue, Suite 210. We offer Pfizer and Johnson & Johnson. And we do that Monday through Friday, 5 days a week, 8:30 until 4 p.m. Give us a call at 205-291-8842 if you want an appointment. Secondly, we're continuing to offer COVID testing. We have seen an increase in the number of cases in the last couple of weeks. We're continuing to offer that 5 days a week as well. I encourage you, if you are out there, if you have seasonal allergies, if you have a history of sinus infections on a chronic basis, if you're starting to have sore throat, nasal congestion, one question that I got was, are the symptoms the same? Could they change? There's a myriad of symptoms, and symptoms present in different ways in different patients, even for this particular strain. For some people, it's presenting similar in the way that the alpha strain presented of COVID-19. For other individuals, they're having more GI symptoms. There are other people that have a fever, have fatigue. There's some people that have headache. There's a myriad of presentations that we're getting with this. So please don't think, oh, I'm not having that one symptom that my Uncle Johnson had, and so that means I don't have it. Please go get tested. Please go get tested. Please go get tested. If you're having any of those symptoms, this is the time when we know there's a high transmission rate. If you're having any of those symptoms, coughing, sneezing, nasal congestion, fatigue, fever, you know, any of that, please go get tested. It's better for you to know than to transmit it to someone else. This particular strain has been called the fastest and the fittest, and part of the reason for that is easier to transmit to other individuals. So that's all I had to share with you guys today. We will log on with you, and I apologize again that we missed the exact time. I was on stage and could not grab my phone and get and log on and talk with you guys as I thought that we might be able to. But I do want to make sure that everyone's aware kind of what's going on and what it means. Yes, you're vaccinated. That means you're more protected. I still, and what I'm doing right now, when I go out places, when I come back into my home, one of the things I shared with you guys last year, when I would come back home, take the clothes off the moment you enter the door, put your shoes to the side, and not taking whatever you're taking out from the environment back into the home with you. Because at this point, it's transmitting and increasing so rapidly, right? That there are a lot of individuals that are becoming infected with it, and they may not know it, right? They may not know it. And you could have a mild case of it and be vaccinated and not know it. So if you're having symptoms, if you have been exposed, please, please, please get tested. That's all I had to share. Happy Sunday, everybody. Hi, Miss Jones. Hey, Pretty Barbie. Hi, Miss Manuel. Thank you for joining. Hi, Miss Shorts. Thank you so much for joining. Hi, Miss Humphreys. So I hope that everyone is staying safe. Again, if you're in need of testing or vaccines, we're more than happy to assist you. If you have not spoken with someone and you still have questions about COVID, if you want to have an appointment, come and talk with us about it. We're more than happy to answer whatever questions you have. If there's another healthcare professional that you know and you trust and that you've watched or followed for years, questions answered and help to protect your family. Peacefully best. Please be blessed. I'm sorry. And stay safe. The vaccine is not going to fully prevent you, not from catching COVID, but I'm still glad that I got it because it still does help. Okay, Pretty Barbie, I'm going to hit that. That's one thing we talked about. So it's not going to fully prevent. And what they mean by that is that there's nothing that can 100% guarantee you that you will not get COVID-19. But there is something, a shot in your arm, a vaccine, that will largely decrease the risk of you getting COVID-19. And that will largely decrease the severity of disease and decrease the likelihood that you will need to be intubated, that you will need to even go to the hospital to be treated for COVID-19 if you're vaccinated. Okay? So, very beneficial. But I do want to touch on this part also. The other part of that circle with can't fully prevent you from catching COVID. Part of the reason, though, and you remember we had a goal for everyone to be vaccinated by the 1st of July, remember? Part of the reason for that is because these viruses change, they mutate. You hear us say that all the time. The viruses change in a capacity that they can outthink the vaccine, but they can only do that when they have a reservoir or a place to reside. They've found a reservoir amongst unvaccinated individuals and replicated themselves. And as they are around other individuals, if you had come into contact with someone and let's say that they are coughing and or they've coughed into their hand, or you've touched somewhere they've touched and touched your eye, this is the fastest and the fittest strain of COVID-19 thus far. That's its nickname. Like Fast and Furious, yeah, you can call Delta variant the Fast and Furious, because that's essentially what's happening. So the other part of that, though, that I want to make sure, because there's a lot of misinformation and a lot of people saying, oh, well, it's good I didn't get the vaccine because I got it anyway. No, 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 no. It's not good, because if you get it and you're not vaccinated, you don't have any antibodies to help protect your immunity, to help protect your body, and to help you have immunity against the virus that's trying to attack your body. So people that have the vaccine have that present, right? They have antibodies that their body is replicating, helping it to fight. People that are unvaccinated don't have anything unless they have a history of COVID. And if they have a history of COVID, that immunity lasts for a short period of time. Okay? So if you're not vaccinated, please get vaccinated. Please get vaccinated. Please get vaccinated. Please get vaccinated. Get your questions answered and stay safe. And I hope that everyone mask up when they leave their home, especially if you're indoors. Okay? That's all I had to share. I hope you guys have a happy Sunday. Okay. Bye bye.